hs-CRP is a little-known blood test, but it could help predict your future risk of a heart attack and heart disease. So it's a blood test I strongly recommend people add to their regular yearly checkup. It's a proxy for inflammation. It's also called Cardiac-CRP. So it's useful to assess if somebody already has heart disease, how much at risk they are for further damage to the heart and the blood vessel walls, and are they at a greater risk for having a stroke or heart attack. But for you and me, my pipes in my heart are pretty clean, according to all the lab tests. It can be predictive if we're going to clog our arteries, if we're going to build up plaque in our arteries, and the consequences of that stroke and heart attack, depending on the level of hs-CRP. Now, there's a more gross figure, a blood test called CRP, not hs-CRP, but CRP, which stands for C-reactive protein. It's something released from your liver when you're inflamed. So it's a proxy, a biomarker for inflammation. It's not thought to do anything. It just lets the doctor know if you have inflammation and approximately how much. Because it increases rapidly and dramatically, it can increase 100-fold in response to tissue injury, like an accident, or inflammation, like an autoimmune disease, like lupus or rheumatoid arthritis, or also an infection. So to look at inflammation in the heart, they have to do a more precise measurement, something that's much more sensitive. It's called hs-CRP, which stands for high sensitivity C-reactive protein, or high sensitivity CRP. It's more precise. I'll give you a little info on what it means. A normal hs-CRP would be 1. If your CRP is 2 or more, it indicates there's inflammation possibly in the heart and in the blood vessel walls, and that's bad because you're actively going through atherogenesis or building up plaque in your arteries. You're stiffening and narrowing the blood vessel walls. If it's over 3, that's scary, because not only are you thickening and stiffening the blood vessel walls, you're narrowing the blood vessel walls, heart disease, coronary artery disease, but it's also inflamed, which means that a piece of plaque can break off, or you could throw off a blood clot that can lead to a stroke or heart attack. There's a much higher risk. So this is a blood test I strongly recommend to my clients, even if they look overall healthy. Welcome to our hs-CRP, a little-known blood test that could help prevent heart attacks episode. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about the blood test that can predict your risk of coronary artery disease and cardiovascular events like stroke and heart attack, and what you can do to lower it, because it's very doable, and it's very safe to lower it, and it's very good to lower it. So be sure to subscribe to the Invite Health podcast today, and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more info. So let's get started. You don't have an hs-CRP test in a vacuum. It's part of your overall health check. So they look at your cholesterol levels, your triglyceride levels, your blood sugar levels. They ask you if you smoke. They check your blood pressure. They do all these things to figure out your risk of a heart attack and heart disease, etc. So when hs-CRP is elevated, it's bad. Just a side note, women on hormone replacement therapy have been shown to have elevated CRP. So that could be what's increasing it. So let's talk about some of the studies. In a study performed in China in April 2018, it was 1,000 participants. They were tested for hs-CRP. They were divided into different groups: 1 or less, which is normal; 1 to 3, which is elevated; and over 3, which is scary. Compared to normal levels of CRP, hs-CRP I should say, an elevation over 1 increased your risk of cardiovascular events like a stroke or heart attack by 1/3. And your risk of dying from these events or any cause by 76%, so it means something. But if your level was over 3, it increased the risk for a stroke or a heart attack by 76%. Big time, and increased your risk of dying from any of these causes by 164%. So having an elevated hs-CRP was connected to heart attacks, strokes, and dying from any cause, including not just from heart disease, not just from stroke and heart attack, but also lung diseases, diabetes, cancer, etc. So here's a study from the University of Minnesota School of Public Health. It's in the journal Annals of Epidemiology. They're looking at 11,200 people between the age of 54 to 74. They followed them for 10 years. They looked at hs-CRP. An elevation was connected to an increased risk of dying from cardiovascular disease by 61%, including suffering from a stroke or heart attack, but increased risk of dying from respiratory diseases by 236%. All-cause mortality increased by 61%. So-called all-cause mortality is dying from any cause, whether it could be any kind of disease, an autoimmune disease, cancer, whatever it is. Let's go to a quick break. Jerry Hickey for Invite Health Podcast. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Now let's look at some solutions. Here's a study in the Journal of the American College of Nutrition. It's from Canadian researchers up at Ontario. It's a state-of-the-art study, randomized, double-blind, placebo-controlled human clinical trial of 90 patients. They put them on krill oil. I love krill oil. Krill oil does a better job of lowering hs-CRP than any drug I've seen so far, but also better than fish oils. Fish oils do have some ability to lower hs-CRP. After 7 days of treatment with krill oil, and they just gave them the regular dosage, like 2 capsules a day, it reduced their level of CRP, hs-CRP, by 19.3%. And after 1 month, it lowered the level by 30.9%, 31%. So almost a third decline within the first month. So here's a second study. It's in the Archives of Medical Science. It's a recent study. It's from the Medical Department, University of Bologna, and the Surgical Department, the Surgical Sciences Department, University of Bologna. Now, once again, it's a gold standard state-of-the-art trial. Double-blind, randomized, placebo-controlled human clinical trial on people with high triglycerides. Let me explain what that is. Triglycerides are another kind of greasy fat in your blood other than cholesterol. And high triglycerides clog your arteries, lead to stroke and heart attack, contribute to heart disease, but they also lodge on your belly. You know, they're part of becoming obese. They lodge in your heart. They cause a buildup of fat around your heart. They go into your lungs, believe it or not, and into your liver and into your kidneys. Not good when your triglycerides are elevated. These people's triglycerides were elevated anywhere from 150 to 500. So they gave them fish oils or prescription, so they gave them krill oil or prescription fish oils, which are super concentrated. Now they gave them twice the potency of fish oils. I don't know why they weren't comparing apples to apples. They were comparing apples to oranges. So twice the dosage of the prescription fish oil to the krill oil. And they switched them around. For a while they were on the prescription fish oils or the krill oil. Then they had a washout period where they didn't take anything. And then they switched over. And they found no two ways about it. The krill was better for lowering inflammation. The prescription fish oils were slightly better for lowering triglycerides. But only the krill oil was able to really improve good cholesterol, HDL. That's the one that sucks the cholesterol out of your arteries. That's the one that helps prevent you from heart disease. But also the krill oil was the only thing that increased apolipoprotein A1 levels. This is the stuff that makes your HDL good cholesterol work even better to do reverse cholesterol transport, once again vacuuming the cholesterol out of your artery walls and your heart. Both the prescription fish oils and the krill oil lowered hs-CRP, but krill oil was much more efficacious. Krill oil just worked a lot better. So the krill oil had the advantages of raising good cholesterol HDL, making it work better, and doing a better job of lowering inflammation in the heart. So let's put this in perspective. Many people who are admitted to a hospital with a heart attack, their cholesterol is normal or even low. They're already on a statin drug. There's something else going on. And the estimate now is about half of all heart attacks is due to inflammation in the heart. And that's what hs-CRP stands for. It's the proxy for letting you know that there's inflammation in the heart. So taking a supplement such as krill oil to lower hs-CRP is added benefit, it's added protection to ensure that you have a lower risk of a heart attack. And this would be above and beyond lowering your cholesterol. So high cholesterol, high LDL, seems to be responsible for about half of all heart attacks. The other half seems to be inflammation. I mean, that's a very good judgment of the ratio, half and half. Now, besides krill lowering inflammation in the heart, resveratrol does also, but a couple of caveats on resveratrol. There's now synthetic resveratrol on the market, and very high doses do have an impact. And then there's the natural resveratrols. But let me say this. Resveratrol is very prone to being damaged by light, any light. It could be a light bulb, it could be the sun, and oxygen. And very quickly, it decays. For instance, if you get a really good wine, a really good red wine, because there's some resveratrol in the skin of the red grape. There's none in the white grape. It's in the skin of the red grape. When you get a really good red wine, there could be 1 milligram of resveratrol in every glass of wine. So that's not a lot, but it's something. But you also get some grapeseed extract. You also get some quercetin. These are other flavonols that work together for heart health, etc. When you open that red wine, that resveratrol decays within 1 day. Now, if you stopper it up really well and you put it right in the refrigerator right after pouring your first glass of wine, the resveratrol can last a whole week. So it's very sensitive to damage. So when we make resveratrol, we go all out. We work with a company called Lonza down in South Carolina, Capsugel in South Carolina, Greenville, South Carolina. They push oxygen out of the room, and there's no light in the room, so that doesn't damage the resveratrol. And then the resveratrol is mixed into a liquid, and we add the grapeseed extract, and we add the quercetin because they amplify the benefits of the resveratrol. But then we get the capsule. The capsule has a really tight weave. It's a vegetable capsule with a really tight weave. It keeps oxygen away from the resveratrol. But researchers at Pfizer showed us at the time how to get the green stuff out of vegetables like broccoli or spinach. It's called chlorophyll. And how to stabilize that into chlorophyllin and impregnate that into the capsule wall itself. And that shields our resveratrol from light. So it's protected from decaying. It's protected from the light. It's protected from the oxygen. This is what you have to go through to make a reliable, usable, functional, stable resveratrol. So make sure that if you purchase resveratrol, it's good quality. It can't be a liquid. It can't be a powder. Otherwise, it's just decayed already. It's not going to work. So here's current medical chemistry, the Department of Medical Sciences, University of Turin over in Italy. And they're looking at resveratrol in smokers. And once again, it's a gold standard study. It's a randomized double-blind crossover trial. So what does that mean? These people were given either placebo or resveratrol for a month. Then they stopped it for a month and they crossed over. The people who were previously on placebo are now put on resveratrol. The people who previously were on resveratrol are now on placebo. And what they found is within the first month, Resveratrol lowered hs-CRP in smokers by 53% within the first month. I mean, smoking really inflames the heart and the brain and the lungs and the rest of the body. This is a major win here. Let's go to a quick break. Jerry Hickey for Invite Health Podcast. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. So here's Archives of Medical Research, another randomized double-blind placebo-controlled human clinical trial. But these are patients with one of those horrible digestive tract diseases, ulcerative colitis. And they gave them either resveratrol or placebo for 6 weeks. And not the placebo. The placebo didn't help at all. The resveratrol led to a significant reduction in a bunch of markers for inflammation. It lowered NF-kappa B. NF-kappa B is a part of the immune system that's very active and destructive in autoimmune diseases. It lowered TNF-alpha, which stands for tumor necrosis factor alpha, which causes wasting syndrome, cachexia, but also is very damaging in autoimmune diseases. And it strongly lowered hs-CRP. So once again, we have another supplement that is functional in lowering inflammation in the heart. See, because a lot of these diseases not only damage where they're active, they also can inflame the heart and lead to things like strokes and heart attacks. So let me go on in this study and look at the next page. I'm reading from the actual study. There were no changes in the placebo group. The clinical colitis activity index score decreased significantly in the resveratrol group when compared with the placebo group and baseline. Baseline means the start of the study before they were given either the placebo or the resveratrol. So not only did the resveratrol reduce inflammation in the circulation and in the heart, it was improving the health of the people with ulcerative colitis. That's pretty astounding, actually. That shows you resveratrol is a very dependable anti-inflammatory agent. That's really safe. I mean, it's good for your brain. It's good for your thyroid gland. It's good for your blood sugar control. It's good for your heart. You can't lose here. Here's the journal Clinical Therapeutics. A very recent meta-analysis was performed of a bunch of studies looking at inflammation and resveratrol. 17 randomized controlled human clinical trials. That included 736 participants, 736 subjects. No doubt about it. Resveratrol reduced hs-CRP. Now, once again, hs-CRP is a proxy in your blood test for inflammation in the heart. If it's 1 or less, like my last test, my level of hs-CRP was 0.5, so it's low. If it's 1 or less, you're fine. If it's 2, you're actively clogging the heart. And don't forget, this can go up like if you had a cold or something. So if you went for your blood test and it was slightly elevated hs-CRP and you had an infection, it could be the infection. So just get it retested. But if it's 2 or more, you're clogging the arteries in your heart. We call that atherogenesis. And if it's 3 or more, not only are you clogging the arteries, but the heart and the artery walls themselves are inflamed. You can actually see swelling and sores, like little bleeding, crusty sores in the lining of the blood vessels if you look with a powerful microscope. And this can lead to the plaque breaking off. It's called plaque vulnerability. It's acute coronary syndrome is the umbrella term, acute coronary syndrome, which means it's dangerous. And plaque vulnerability, meaning the cholesterol waxy plaque that built up in your arteries is unstable and inflamed. And if it breaks off, it leads to a stroke or heart attack. If the level's over 3, is a much greater dynamic for that. There's a much greater risk of having a stroke or a heart attack. So in 17 human clinical trials with a lot of people in there, resveratrol absolutely, dependably lowered hs-CRP. That is pretty cool. Let's go to a quick break. Jerry Hickey for Invite Health Podcast. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Now there's another supplement that lowers hs-CRP. It's sterols. Sterols are also called plant sterols, and they're called plant phytosterols or phytosterols. That's why it's hard to find the studies in them. You have to use all these different search terms. But sterols very dependably lower your cholesterol. You take them, they come from plants. There's no cholesterol in plants, but they kind of look like cholesterol. And you take them before a meal, and they block the absorption of cholesterol from your food. And very dependably, your cholesterol levels can drop starting within the first week. So if you can't take a statin, this is a reliable option to a statin. You take one capsule with a glass of water right before each meal, your cholesterol levels drop. And if you add it to a statin, because it's working differently, you'll get a real bonus in lowering your cholesterol. The statins work in your liver, blocking the formation of cholesterol. The sterols work in your intestines, blocking the absorption of cholesterol. So that's a real win, because some people can't double the dosage of their statin drug. Otherwise, they wind up with a lot of fatigue, and they can wind up with muscle pain and a drop in their endurance, etc. So by adding the sterols to your statin, it's basically like doubling the dose of the statin without any of the risks. You might be fine on a low dose of a statin like atorvastatin, but if you double it, that's when you may encounter all those side effects like the fatigue, the drop in your endurance, and the soreness of the muscles. Now, so in this study, it's called Lipids in Health and Disease. It's a very recent study. They combined fish oils and plant sterols. And it was 200 participants. They gave them the fish oils and the plant sterols or placebo for 12 weeks, 3 months, and it really worked. Compared to the placebo group, those on the combination of the sterols with the fish oils, a real drop in their triglyceride level, a boost to their HDL good cholesterol, their blood sugar levels improved, but because of the sterols, it lowered their hs-CRP also. Between the sterols and the fish oils, it lowered their hs-CRP. So that's a win-win-win combination. Here's another one, similar. School of Biomedical Sciences, University of Newcastle in Australia. It's in the journal Atherosclerosis. Same deal. They gave people a combination of fish oils and sterols, plant sterols. Fish oils lower triglycerides, plant sterols lower cholesterol. The combination reduced hs-CRP by 40%. That's powerful. It lowered TNF-alpha by 10%. It lowered interleukin-6 by 11%. That's really good. Interleukin-6 is a cytokine, a chemical released by the immune system that clogs your arteries. And when you have heart disease or heart failure, an elevation of interleukin-6 is a really bad thing for your prognosis. It's just a bad sign for survival. And it also lowered interleukin B4 by 30%. Now that's very interesting. Interleukin B4 stimulates an inflammatory complex called 5-lipoxygenase. 5-lipoxygenase kills your brain cells. 5-lipoxygenase inflames your joints. It inflames your colon. It inflames your heart. It inflames your lungs. It inflames your skin. It's involved with pain during menstruation. It's involved with metastasis of cancer. It's involved with asthma. So combining the fish oils with the sterols not only lowered triglycerides and cholesterol, but it lowered all of these really nasty inflammatory things released by the immune system. So the overall cardiovascular risk, of developing heart disease and suffering in the future with a stroke or heart attack was reduced by just about 25%. This is all really good news. So here's the last study I'm going to read you. It's from the University of California Davis Medical Center. That would be in Sacramento. It's from the American Journal of Clinical Nutrition. And they gave people with high cholesterol sterols added to a liquid. So it's 72 healthy people with high cholesterol, high LDL. They gave them the sterols in the beverage. Now, sterols, in all the studies I've seen, sterols work better in the capsule, by the way. They gave them sterols in a beverage, and it really helped lower their cholesterol. It definitely helped lower their total cholesterol and their bad cholesterol, their LDL cholesterol. But it also improved their HDL. This is something sterols have been proven to do. But it also lowered inflammation. It lowered their inflammation on average by 12%. These supplements are real. They really do have an impact on inflammation in your heart. So just to review very quickly, fish oils lower inflammation in the heart a little bit. But if you add sterols to the sterols to the fish oils, it lowers inflammation in your heart by a pretty darn good degree. Sterols on their own lower inflammation in the heart. Resveratrol lowers inflammation in your heart, and so do krill oil capsules. So krill oil capsules and resveratrol and sterols, to a lesser degree fish oils, they lower inflammation in your heart. Thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcasts. Make sure you subscribe and please leave us a review. You could follow us on Facebook, Twitter, and Instagram at Invite Health Today. We'll see you next time on another episode of the Invite Health Podcast. Thank you so much for listening.